Tonight, the city of St. Louis is recommending people wear masks indoors because of a recent surge in respiratory viruses. They're hoping to limit the spread of illness that include the flu, RSV, and COVID. A lot of people sick out there. Thank you for joining us. I'm Ann Allred.
And I'm Mike Bush. The city's health department made that announcement just a few hours ago, hoping to avoid a strain on the St. Louis healthcare system. Our Justina Cornell joins us in studio with more on all this. Justina?
Yeah, Mike and Ann, so St. Louis City's Department of Health is recommending mask wearing indoors in public spaces and in crowds where social distancing isn't possible. Now, this recommendation comes after looking at the recent data showing hospitalizations are up.
This has certainly been a much busier season for viruses.
It's a wave of winter viruses.
Most of these viruses are mostly prevalent in the winter months.
So much so, St. Louis City's health department released these numbers. COVID hospitalizations are up 38% over the past month. RSV cases within the BJC healthcare system are nearly 200% higher than the past 4 years. And flu infections are 55% higher than the highest median value of the past 5 years.
And then with the holidays, with people traveling, getting together with families, that definitely doesn't help.
Seeing the surge are SSM Health Cardinal Glennon doctors Dr. Amit Mathur and Dr. Heidi Sally.
Certainly a lot more RSV this season compared to the last couple of years. Schools have just restarted. That's the other place where once schools start, a lot of children mix around. Pick up infections.
Dr. Sally worries about the littlest ones.
RSV can be very challenging for them, and they often end up in the hospital, more so than with the COVID or the flu.
Both doctors recommend staying home if you're feeling sick.
If there's anything that feels out of the ordinary to you, then I'd suggest trying to get in to see your doctor and get checked out.
Dr. Sally also recommends a preventative tool.
Vaccines. The idea of these, especially COVID and flu vaccines, is that it prevents serious disease.
The city's health department also said the recommendation is data-driven and focused on lowering community transmission of potentially deadly diseases. And if we do our part, we can expect the number of cases and hospitalizations to decrease over the coming weeks.